Is the owls.
Oh, the owls are doing, okay.
So will you turn yours off?
Okay, so can you still hear me, Tom? Yeah, we can, because I can hear you. So. Why does this seem like such a small? We've got 9 online. And so we'll figure out who's here and who isn't. So welcome, this is the regular Board of Health meeting on August 10th. Your chair, Greg Poshman, and welcome everyone in person and online. We're at the county commissioner meeting room, if anybody's looking for the location. First of all, do we have a quorum? I'm just gonna ask you.
We do.
Do I need to do an informal roll call? Because I'll have to remember who's all.
No, we,
No,
no phone roll call. We'll record it, but, if everyone would be willing to just do introductions, we have a new admin specialist, Nancy Payne, starting with us, who's gonna be taking some minutes today, so that she can get to know everybody.
All right, we get Greg Bushman, Dayton County Commissioner. I'll go that way.
Tori, Mayor of Aspen.
John Doyle, Aspen City Council.
Linda Vieira. At large.
Sorry.
Liz Stark, at large.
Tom Kirk, position with public health training.
What?
We're doing over now.
And then online, we also have.
Christine is here.
I'm in as the alternate for Susan Moralt, who's out of town
Well, we
today.
can't hear you, Tom.
Go there.
Huh, can you hear me now?
We have the ability to turn that on.
You don't?
I don't have the.
You hear me?
Do that.
We can call Michaela.
Is there a remote behind you somewhere? There might be over there, a remote kicking around over there. See if that one will do that.
Georgiana, I can hear him. I'm on remote and I hear him.
Can't hear Kelly either, so let me make sure the volume is working on it.
So just whatever you want. There you go. Look at that. Well done.
Oh, you got it, Kurt?
Yep. TV.
All right, can you hear us now?
Yes.
We hear you. Introduce yourself.
Nomads Village, I'm sitting in for Susan Moralt.
Great, thank you. Anyone else? Other than we have Kelly's on, we've all got a lot of people here. Are we gonna introduce everyone?
Oh, Barry? Barry's on.
Oh, and Barry.
Oh, there she is. Okay, just saw that pop up. Barry, give us an introduction just so staff knows who you are. If you hear me.
If not, Barry
It's gonna
Ramsberg.
keep moving.
Barry Ramsberg is our.
Can you hear me now?
There. Just introduce yourself to our new staff.
Hi, I'm Barry Ramberg. I am the alternate Board of Health member and I'm currently not in Aspen, so sorry if my connection is poor.
Sounds good. Thank you.
Thank you.
Okay. All right, I guess I'm going to move on to, we can take a look at the agenda. Are there any additions or deletions from the agenda today?
Nope, this one's good to go.
Okay, we're gonna keep moving with it. If anybody would like to make a motion to approve the previous minutes, which is so moved. Second, got a motion, a second from Cory, motion by Kurt. All in favor? Aye. Okay, thank you. Now we're going to public comment. If we have anybody from the public here in person or online who would like to comment. I don't know if you can see if you can raise your hand or not. If I can tell.
I can
It
tell.
doesn't look like you do.
Nobody is raising their hand for public comment, Greg.
Got it. Okay, I'm gonna close public comment and keep us moving. So next, the environmental health fee approval, report. Kurt Dahl from Environmental Health. And I know you're gonna be talking about that.
The mics work, Melissa? Do we need to turn it?
It's all through the owl.
It is,
Mhm.
okay, okay. Thank you. Brian's gonna do a presentation. We have, changes to our environmental health fees, just a few of them. It's a pretty simple change, but as Brian will explain, the Board of Health actually has the responsibility for setting environmental health fees. So,
I was hoping you would
you want me to
explain
do it? I
that
can-
better.
no, you can do it. I can do it. So we've set up a process. What state statute says 25-1-508, I think it's like paragraph 5 subsection J, actually states that the Board of Health is responsible for providing environmental health services and then setting fees to offset the costs for providing those services. However, it's a little confusing because the Board of County Commissioners is responsible for the budget and the fiscatory responsibility for the actual environmental health department, so it's a little confusing. So the way we've addressed this process in the past is we have gone to the county commissioners, presented, and in this case, we presented the fees on August 1st to the VOCC and asked them for a recommendation to the Board of Health to approve the fees. And so we did our presentation, quick little 15-minute presentation, discussed it with the board, and they did make the recommendation to go ahead and to the Board of Health to approve the fees. And so now we're here officially to then discuss this, and then there will be a motion from the board. And then if it's seconded and you all agree, we'll then approve the fees.
Didn't we approve something like this a few years ago where this would be a renewal or update?
Yeah, so in 2020, we did change our fees significantly. This is a minor revision to that.
Thank you.
In 2020, we, the septic system fees, or OWTS is the program, were restricted in state statute to a maximum of $1,000. And so Dr. Kurt, you're remembering when we, that was removed out of statute, and then we were able to charge our cost recovery, which for us was a big difference. We were well over that $1,000. So.
Yeah, so the minor changes that we are asking to make, the first one is licensing fees. And we have always kind of worked in conjunction with Eagle County and have used their testing information. They could take a test in Eagle County and submit that to Pickens County for licensing. So we're kind of hand in hand working together. They had increased their license fees to $50. They used to be $35. So we felt that we should do that in line with the other departments that we share this with. So it's a very minor change, only $15 per year. So, and that's for anybody that's doing the septic inspections, when they do house sales or major remodels of their home, confirming that those septic systems are functioning correctly, as well as when people are installing their septic systems, those would be the contractors, and then the people who maintain those systems with the pumper trucks or the cleaners. So each of those licenses would go up $15 per year. The other fee that we are going to be adding as a new fee type is for re-reviews of OWTS applications that do not meet the requirements. And we're asking that fee to be $200, which is a little more than an hour's worth of time for our hourly rate currently. We've seen a lot of system applications that are very poorly put together and incomplete. And we were hoping to have some sort of incentive for the applicants to apply properly and give us complete applications to not waste as much staff time looking at incomplete things.
Can you describe who is a typical applicant?
Yeah, so the typical applicants are either usually the septic designer themselves, or a lot of times it'll be the general contractor for the project. It's very rarely that it would be a homeowner.
Right, okay, so hopefully it's a small pool of people to be educated on how to submit it.
Yeah, and we're very available and happy to work with them to make sure that they have complete applications before they submit. It's kind of a after effect of how the building permits come through, and needing to have their septic system applied for before they apply for a building permit. So,
And is that a one-time fee? Or the
For-
hourly?
which, I'm sorry.
Well, the
Oh, it'll be $200 flat fee.
flat fee.
Yeah.
Okay, all right.
I mean, if they don't do it good again, then it'd be another $200, but yeah.
Right. Keep coming back.
On behalf of the sewer service industry workers, I want to say that these fees are for crap.
And
Could you warn the architects, which should be including this in the design of the house and the property?
I mean, there'll certainly be information on our website as well as on the applicant tracking system that we use, Sages.
And we have a contractors list that we will, presuming this gets approved, we can send this information out to them so that they're forewarned that there will be an additional fee as well for the contractors and engineers who are the designers to make sure that there's an understanding of this new fee.
So you just, kind of do a cursory review of the application to determine that it's incomplete? And
So that's going right into the full review where we're looking for code compliance as far as the setbacks that they did, the soil testing that's required. So there's not really a precursor review, it's the full thing.
so you do the full thing, you find it's incomplete,
Mhm.
charge them because you gotta do it again.
Yeah.
Okay.
Do you give them an example, of, you know, kind of a pseudo application that they can follow?
There isn't, but the template form that's in the Sages application system does guide them very well as far as specifically what types of documents they are required to submit. And a lot of times we'll see blank documents submitted or nothing. So I think it's pretty clear, but yeah.
Hopefully this will make a difference. This has come before the BSCC already, as you mentioned, and we moved it forward, so.
This was also modeled after some other counties.
Yeah, I think it was a Jefferson County that's, a couple of Front Range counties, I think, it's either Jefferson or Boulder that, you know, I think we got this idea from them because they see the same thing, and our fees are all structured very similarly. We charge a flat fee at the beginning of the process. And so any, come back to actually charge fees is very atypical. It's usually done in one shot, but because we're seeing this across the state, this is not unique to us. A lot of incomplete designs, or designs that are just inadequate. And frankly, I've looked at a couple that have been looking like they were from a different system that they just threw together completely for a different residence and didn't bother updating it. So we're seeing this across the board. And so we've seen 2 counties do it that I was familiar with, but you know, I think you'll see another, several other counties try to address it this way.
This sounds remarkably similar to what we hear from our building department. That incomplete forms are turned in and it takes staff extra time to try and sort it out, so we can apply this to our building department.
Yeah.
Really, unless somebody else has a comment, I would just go ahead. Yeah.
It's $2,023.
For a septic permit, yeah.
Does it go up to $2,024 next year?
So this was calculated out as the approximate amount of time that it takes to review a septic system based.
Accidents.
Well, it's sort of. There's a $20 fee that goes to the state for each septic permit. I think we had a $3 administrative extra fee on top of that, and that's where your $23 comes from. And yeah, it stayed that way it was 1,023 for an extremely long time, and now it's been this for 3 years.
And that $23 that's actually in state statute, that's to support a state health department employee. They're looking at changing that, so we may be coming back here in the next couple of months to actually request a change to this because they're 24 for you.
Yeah.
So I may very well be
Next year, I'll be here before you know it.
Yeah.
Call it the Torium and
$1 a year.
I'll push for $24 and not 84.
here when you're at the state meeting. So contractors, engineers, builders, you know, be warned, you know, you're gonna be charged an extra fee if you don't have your paperwork right. That's the message. Do we need a motion to approve this?
Yes.
We do. Motion. And,
Second.
and a second from Linda. All in favor? Aye. Thank you. Okay, that's
Thanks.
done. Moving right
Thank
along.
you.
Coming right along, Healthy Kids Colorado Survey. Raleigh, is that next?
Hi, everyone. Can everyone hear me online?
Yep.
Okay,
There you
wonderful. Well, good afternoon. Raleigh Backrack Health Promotion Program Administrator with Pickens County Public Health. And today we'll be going through some slides just around some work that I've been doing around a prevention-focused analysis regarding the local Healthy Kids Colorado survey results. Next slide. Wonderful. So, I do want to start off and say that we at Public Health have been partnering with Aspen School District, specifically Aspen Family Connections and Sound Check Prevention Network, to partner and build an understanding of our most recent and local data in relation to youth substance use and mental health. And that's all obtained through our local Healthy Kids Colorado survey. We consider here today, how these data compare to the region and the Colorado averages, and what kind of trends we've been seeing over the last few years. So data can be used obviously in many different ways, and the objective here is really not to sensationalize, but to really give us this informed basis for designing improved approaches to programming in the Aspen School District. And then prevention-focused efforts are really to address substance use and mental health. They're obviously clearly not the sole responsibility of the school, but we also see that it needs to be embedded throughout the community. If there's change that needs to be made, we must all work towards a culture of prevention, equity, and inclusion. So what we have here today in the slides that I'm about to present, it's not an exhaustive list, an analysis of the very extensive Healthy Kids Colorado survey, but rather a selection that Aspen School District, Aspen Family Connections, and Sound Check, would like to focus on. And that's really addressing our main concerns, specifically around youth substance use and mental health. Next slide. So just a quick background on Healthy Kids. It's administered every 2 years. So the last year that it was administered was in 2021. We're prepping the school district as well as school districts basically throughout the valley on the next fall 2023 survey year. We have seen that Aspen High School has consistently participated in previous years. We're seeing not a huge turnout for Aspen Middle School, but that is certainly an important area for consideration in the future to really, help us understand a little more about the lives of our youth, especially our younger teens, and that way we can start to design prevention goals and activities that really align with those results. So finally, I heard someone.
Sorry.
No, you're good.
Can you tell us, 475 participants at Aspen High School sounds like 95% or 90%. I'm not sure what the total student body count is, but that's about it, I think.
Yeah, so for the high school, correct, Greg. Yeah, the high school, we've had really strong participation. I believe in 2020 that 475, I believe it said it was 100%. Right. So exactly. So Aspen High School, strong sample of that. We also look at Region 12, which includes Pickens, Garfield, Eagle, Summit, and Grand County. Colorado averages for that survey, Healthy Kids Colorado. And then lastly, the data, we look at some national data from the CDC YRBS.
Right. So just regarding the middle school, what is it going to take to get participation? We're at 100% of the high school. Middle school shouldn't be too hard to penetrate. Yeah. Is it a teacher or a counselor, or who's driving it over there?
So it's quite interesting. It's more of an opt-in survey. So it really actually starts at the district level. Again, we have seen Aspen School District opt-in most years. But after the district approves that, it goes directly to the school for opt-in, and then it actually goes to parents for that kind of final say. So I think, maybe the reason why we haven't seen a ton of middle schoolers participate, at least not to have significant results to report out to you all, is maybe because concerns around the type of questions. They are quite, serious around substance use and mental health. So there might be concerns around there. So it's really working with not only the school district, but reaching out to parents and letting them know why, responses from youth are so important.
I was just thinking, we have our vice chair of the Board of Health is Krista Giesel, who's, I don't know if she's chair of the school board or if she's perhaps vice chair of the school board. And I'm hoping that she could help us encourage the middle school parents through the school board perhaps to take this seriously, especially when we look at the numbers I think you're about to show us.
Yeah, exactly. Great point.
I could comment, because I was involved with the Elks Drug Awareness Program for 3 years. The liaison with Healthy Kids Colorado there in Mulberry, the assistant superintendent of schools. So he's in charge of that program locally. And there's a MSW, Anna Royer, who's at the CU Anshin Center in Denver, who coordinates all of Colorado. And the interesting questions are related to vaping, alcohol use, but also you want to look at the trends and then compare Aspen and the Roaring Fork Valley with other areas of Colorado. The
Right.
trends and comparisons.
Right, and that's kind of the concerning thing from the data we've seen previously. So Theron, maybe Theron is your point of contact, obviously, I guess you already know this.
Yeah, so the school has seen the data, the report that we're working on with Aspen Family Connections and Soundcheck. Of course, it's not just me. I'm part of a much larger effort. Catherine Sand specifically, she's done an amazing job to get Soundcheck on board to really focus on this prevention effort. So I think the school is taking this very seriously. And Dr. Kurt, as you were talking about, the next few slides, we'll definitely dive into what we look like locally compared to our region, state, nationwide, and we're looking at trends as well. If there's no other, go ahead.
School, as an Aspen school product through the Aspen school system, I remember 8th grade wasn't too soon to be talking about this. Right.
Of course.
Yeah,
as we're seeing, prevention needs to start earlier, as we're seeing substance use and mental health issues starting earlier, right?
Thank you. Go ahead.
Any other questions, or may I move forward?
I think you can keep going. Thanks.
Okay, wonderful. Next slide, please. All right, so let's dive into it. The issue in 2021, Aspen High School students reported using substances regularly, such as tobacco and nicotine and alcohol, more often compared to Region 12 and the Colorado average. So here in this graph, Aspen High School students, we are in that orange, Region 12's in that dark blue, and then Colorado average is in that light gray. And so this data is unlikely to surprise many. Our young people are growing up in this high profile resort in which the use of things such as alcohol and marijuana in particular is ubiquitous and plays a significant role in the success of our local economy. Next slide. So progress at a glance. So as we know, substance use during adolescence is associated with negative health, social, and economic consequences, as well as we've seen changes in brain structure. So substance use variables below include the percent of Aspen High School students who drank alcohol, used marijuana, used an electronic vapor product, and or misused prescription pain medications without a doctor's prescription, during the past 30 days, which is kind of considered current use. And we're comparing it to 2017 Healthy Kids Colorado survey data results, to 2019 and to 2021. And if we look all the way to the right, the column that says trend, we're starting, we can look and see what that trend is kind of looking like. So that yellow is, we haven't really seen a ton of movement in those past 5 years. That red for marijuana use, we have seen our local numbers increase. And, if we're thinking back to the legalization of marijuana, that may contribute to this, this negative trend line that we are seeing locally. We're seeing some numbers look better around youth regular use of electronic vapor products. And again, going back to laws, if you all remember 2017, 2019, a lot of local, state, as well as national movement in tobacco control policies. So that might be beneficial in those numbers that we're seeing. And then the last one, we have seen that number decline as far as regularly misused prescription medications. I will note, when I was mentioning that we had more than 400 plus participants in the 2021 Healthy Kids Colorado survey data, doesn't necessarily mean that all those participants answered every single question. So some of these questions definitely have lower statistical significance depending on the sample that we have. So, and while statistical significance can help determine that reliability of a trend, it doesn't necessarily account for considerations when using data to inform the public health. So that trend that I'm pointing to might not be statistically significant, but I did want to bring it to everyone's attention here, and just seeing what we're seeing in the last 5 years.
Got another question of you, just regarding compared to the other schools in the region. I'm still shocked by the comparison numbers. And I'm just wondering, what is the saturation of the survey within the other schools? Are they getting a similar sort of response from students, or is it just a smaller fraction, for instance? And I'm looking for ways to dispute these numbers because I'm having trouble, as I did last year, had trouble with this. So how reliable do you think the Healthy Kids Colorado survey is comparing kids in our schools to kids in other schools?
Yeah, that's a great question. I would say they are pretty reliable, especially when we are looking across these 5 years, for instance. As far as other school participation, I believe the Healthy Kids Colorado, they have kind of a threshold for reporting. So if it's below, a certain number, there, for instance, we'll get into this a little later, but for Aspen High School, we break it down into demographics, for instance. We don't have strong enough numbers to look beyond male, female, and race. There's just kind of mixed race is one category and it doesn't dive into anything else. So going back to your question is, there is that threshold of reporting methods. I also will say that, I know other school districts sometimes don't even opt in. And that's another issue that we're seeing, especially in the Roaring Fork. And that's another initiative that we need to ensure we're getting the word out.
My last question along those lines would be, is anybody who's analyzing the data at Healthy Kids Colorado noticing the data from here and seeing anything that might point to anything other than what we think we're seeing? In other words, how reliable, do they see red flags when something what could be construed as an anomaly? Are they noticing that and bringing your attention to it, or do they just send you the results?
Right. So I believe a lot of schools and school districts are just, kind of sent the results, and it's a lot to digest and chew on. And I don't think a whole lot of schools are able to dive into each question like we are today. for instance, Aspen, we rate really well on, let's say, eating, nutrition, things like that. But no, I have never been contacted by the state personally with any red flags necessarily. That's, I believe, why there's programs such as the state tobacco and education program that I implement here locally to take, look at these issues and see what we can implement to better the results.
Point of like before the state sends the data to the school districts, they'll look through and clean it. And so if there is some anomaly that's happened or something very strange in the data, they'll dive in and look at that before they send it back to schools.
Okay, great. Thank you.
Thanks,
So we can
Jordana.
trust the data.
Yes, and we did an op-ed, Sarah Mulberry and I did an op-ed in, I think September, October 21. And it was in the Aspen Times, with, as well listing all the sources for help locally, dealing with addictions like A Way Out. And the survey is done, I think, in November, and the results are released, I think, in May. Is that correct, Raleigh?
I'm not too sure. Are you talking about Healthy Kids Colorado?
Yes, I think the survey is done in November, and then the results are published in May.
Yes,
you
you
have-
are correct. Yes. Around that timeline. Yep. Fall administration, and then by summer they usually come out. So we'll have the 2023 results next summer.
So this would be an opportune time to get to that audience of students about drug awareness.
Exactly. Yeah, that's a great point.
Thank you. Okay, any other actions needed here, or is this just informational for us?
There's a
We have
more
quite a
slides.
few more slides.
Keep on going. Thanks for the question.
I
Put me
will
on
try
the-
to go ahead.
No, just saying, I'm putting you on the spot. You're doing a great job.
Oh, no worries. Happy to keep answering questions, but I will be throwing more data out there to you all. So looking at trends, so this slide here, we're looking at the percentage of high school students who drank alcohol during the last 30 days. We're also looking at not only Healthy Kids Colorado survey data, but the CDC YRBS data. So again, we see Aspen High School in that orange, red at the top, Region 12s in that dark blue. Colorado, you can barely see it. It's in that gray, just because that national CDC YRBS trend line is just covering it slightly, since they're so similar. And so here we are seeing that the percentage of Aspen High School students who reported drinking alcohol during the past 30 days in 2017, 2019, and 2021 remained steady and at a consistently higher rate when compared to the region, Colorado, and the national average. I will also point out here, this slide and the next few slides, while I am comparing the CDC's National Youth Risk Behavior Survey, it is important to note that while the two surveys, so Healthy Kids and CDC, ask very similar questions, there's differences in methodology, wording, context, sampling, et cetera, between the two surveys, which it does create some limitations when we are comparing. So the above comparisons are really meant to just provide some context related to these differences at, that local, region, state, and national level, but did want to point that out to everyone. Next slide, if there are no questions. So here we are looking at trends in the percentage of high school students who used marijuana during the past 30 days. And we are seeing that the percentage of Aspen High School students who reported using marijuana increased from 2017 to 2021, whereas regionally, statewide, and nationwide, there has been a decrease of current marijuana use between 2019 and 2021. And, again, kind of going back to the legalization of marijuana, that may be part of why locally we are seeing that increase just due to that accessibility of marijuana retailers locally. Next slide. Oh, go ahead.
Sorry, just looking at this, the Colorado data though is contradictory almost to what's happening locally. And the marijuana was legalized statewide, right?
Yep, exactly.
So I'm wondering how we compare that, and it'd be interesting to compare that to other states that had legalized and see if they've had a similar trend, or if this is just Aspen for some reason, or other resort communities. Liz?
Yeah.
Kelly, can you remind me what counties are included in Region 12?
We have Picken, Eagle, Grand, Garfield, and Summit, I believe.
Oh my
So
God,
it's also, that's an interesting mix, I will say, right? I did not choose that.
It's been so wacky to me, but some of those have resort communities in them.
Yeah.
Some don't. So it's kind of hard. It's not really comparing apples to apples.
Yeah.
But if you think about what the other communities around that are, it might make a little sense with these graphs. Talking about some of your, Garfield, was Garfield in it? Yeah.
Yes.
Some of your Field areas, and the like. These graphs, this information is, really, interesting. And I like the way that you presented it. The trend lines are very interesting to compare.
Thank you. Yeah, and I think that's a great thought too, of maybe reaching out to Summit and Eagle and seeing if we could compare more local data and seeing what those trends look like around mountain towns. Any other questions around this slide? Okay, next slide. Okay. So I believe this is the last trend slide. We have a few more though after this. And this is just looking at the percentage of high school students who used electronic vapor products during the past 30 days. And so we are seeing that there was an overall decrease in regular vaping use when we're comparing 2017 to 2021 data amongst all data sets. However, the percentage of Aspen High School students who reported using these products during the past 30 days remains higher than those other three comparisons when we look at 2021 specifically. Next slide. So access to substances in our community. In 2021, the percentage of high school students who reported it was easy to obtain certain substances such as marijuana, alcohol, and vapor products, they were higher amongst Aspen High School when compared to Region 12 and the Colorado average. So again, Aspen High School is in that orange, Region 12's navy blue, Colorado light blue. The data does support that there may be a need to reduce underage access to substances in local shops, facilities, restaurants, etc.
I'm wondering if, has anybody done any pricing data on this? Is the cost of acquiring any of these things higher here or lower, or could it have anything to do with the demographics of affluence in this community? I'm just trying to figure out how do we, is it that much easier to get because they can afford it, or is it more permissive in our community? Still trying to get a grip on that.
Yeah, I might not have the best answer, but I think it's maybe all those factors that you were mentioning. Just living in a wealthier resort town, seeing, look, that's kind of the norm, is we have this party culture at times. It's a mountain town. I don't necessarily think it's only by going to shops and having a kid use a fake ID, but maybe taking it from parents or friends or siblings. I think it's a mix of things. But, when we look at best practices in, for example, the tobacco world, we do have tax on tobacco products and things like that. And I'm not sure how we could, potentially make that a thing across the board around alcohol, let's say. But that's a great thought.
Okay, thanks.
Next slide.
Another question, Dr. Kurt.
Oh,
I've noticed when you get the sales tax information, the city of Aspen, that cannabis, or the cannabis sales tax from cannabis shops exceeds that of liquor stores now. Liquor stores have not decreased in their tax, but the cannabis now exceeds that sales tax.
Interesting. Yeah. All right. Community social acceptability. So we do see in research that adolescents' risky behaviors are really influenced by these social norms that we were kind of just speaking to, which are really created by parents, peers, and our community. So in 2021, the Healthy Kids Colorado figure below shows that Aspen High School students are using substances at a higher rate compared to Region 12 in the Colorado. And reasons for using substances, one is students think it's socially acceptable and that everyone does it. So we're about 9% of those students are using substances because they think it's socially acceptable. And then if we go to the next slide, we're seeing that they're also using substances for experimentation or using substances to have a good time with friends. And so this really does support the need to build on perceptions of and opportunities for kind of that non-use as an acceptable and normalized behavior within not just the school, but throughout our community as well. Next slide. Perceptions and communities' social norms. So again, social norms may cause individuals to incorrectly perceive attitudes and behaviors of their peers. So in this case, adolescents overestimate, these risky behaviors amongst their peers and community members, maybe possibly due to that normalization of substance use. So we all, I want to mention that we make generalizations, even in this report and presentation and we make generalizations about our community culture, but it should be remembered that young people are very susceptible to all kinds of messaging. So we need to be very deliberate when we're speaking about an approach when we talk about substance use and mental health. So the figure here, it might at first be a little confusing, so let me walk you all through it. So it compares Aspen High School students' perception of their peers and their substance use of their peers to actual use. So in that dark blue is students' perception versus actual use, which is in that lighter gray. Next slide. Perception of risk. So in addition to feeling that substances and substance use is something everyone is involved with, young people in our community have a lower perception of the risks of such when compared to Region 12 and the Colorado average. So the figure below emphasizes the need to increase presentation language and messaging. As in 2021, we have Aspen High School students that were less likely to think the use of substances is wrong when we're comparing it to those other two data sets. Looking at well-being, mental health, and coping. So as we all know, adolescence is a time of transition where young people are likely to seek out strategies to cope with stressors. Of course, stress is just a normal part of life, but ineffective coping strategies can really lead to poor physical and mental health. So the figure below shows that Aspen High School students are more likely to resort to coping by using substances when we are comparing it to the region and the Colorado average. And so, I think this really underlines kind of that importance of our school and community to look at prevention strategies designed to improve access to mental health, as well as opportunity for positive engagement with peers and adults. Next slide. Considering mental health amongst our young people. So mental health is measured in the Healthy Kids Colorado survey by addressing feelings of sadness or hopelessness that impact a student's ability to participate in their usual daily activities, as well as by assessing poor mental health during the past 30 days, which includes suicidal thoughts and behaviors. So below are figures from the 2021 results. We see, we'll read left to right, so that it is broken down with total at the top, and then we look at race and sex, and that we do see that there are significant disparities in the results for female and multiracial students that bear more analysis and discussion about approaches. So the left, we have Aspen school female students and multiracial students reported higher rates of feeling sad or hopelessness compared to their white and male counterparts. And then to the right, we have Aspen High School female and multiracial students reported that they were seriously considering suicide compared to their white and male counterparts.
Keep that there for just a moment.
Of course.
I have a question I'd love to bring up here because this is something that's on the topic. I have high school graduates now, they were high school age kids. And one of the topics of discussion that I saw from them is the number of kids, I don't know the percentage, but we have numbers of kids who would not identify as male or female any longer. And I'm wondering if there is a plan to include cisgender or different categories in this survey, because that might actually help us.
Yeah, that's a great point, Greg, and I should have mentioned that earlier before this slide, but there are opportunities for students to select their identity. What we are seeing though is, maybe that's just such a small sample size and possibly students might not feel comfortable answering that. We don't know exactly why, but we basically don't have enough data that the survey results from Healthy Kids Colorado give us. There's just no answer there when we're looking at the results. But that's a great point, and I think that's another messaging and just communication strategy that we could not only for the school and school district to consider about promoting equity, but seeing maybe how Healthy Kids Colorado survey could make that a little more clearer for us to understand. Mm-hmm.
And probably what I'd say is that while we don't have this, we're not gonna have a big enough sample size to pull those kids out at the Aspen School District level. At the state level, for sure, we can pull out, and we do see that LGBTQ youth are disproportionately affected, especially in these areas of, feeling down and depressed, suicidality, and even some more of the risky behaviors as well. Yeah. So we can use that to infer that we know that's a population that should get some extra care and attention.
Yeah, thank you for that, Jordana.
Thanks.
Any other questions? We're almost there. Okay, next slide, please. So where does this data take us? So as I mentioned earlier, I'm just a small part in this amazing project and effort that Aspen Family Connections is heading. So, really, I'm reporting out on kind of their next steps, and I'm just grateful to be a part of that opportunity with them. But we are seeing that many people in our community might just be unsurprised by some of these data points in the presentation and the report that we wrote up. Substance use is kind of this ubiquitous party town issue, and young people we see have access, and often means that they can obviously obtain these substances. So added to this is a community with a high tolerance for substance use in kind of that day-to-day life. And this inevitably filters down to teenagers from parents, siblings, whatever it may be, tourists, so that they experience easy access to substances combined with a relatively low perception of those risks. We also know that Aspen, our community, can be a stressful place sometimes to live. And we were really struck by the numbers of students reporting fairly significant mental health concerns. And then in turn, those who are reporting to use substances to cope with those feelings. Next slide. So some practical steps that Aspen School District is taking. So they're continuing to work with SoundCheck, which is a prevention external consultant. So building on that logic model, really reaching out to school, parents, teachers, athletics coach for that engagement and education. We want to make sure we're reaching out to our community, especially the business community, alcohol, tobacco retailers, marijuana retailers, etc. Aspen High School has started to have these sober events. I believe the most recent one was just at the end of the last school year, and it was successful. So having a good precedent for sober events is super important. And then really focusing on curriculum-based approaches to social emotional learning. I will open it up for other questions, but I believe that is my last slide.
Great, thank you. Questions?
I'd like to give the input, since 16% of the American population is addicted to either alcohol or drugs, that the sequela on families and your personal career is tremendous. And to be sending such a high percentage of our young population out in potentially, as we know, if people are using cigarettes by age 18, they're usually addicted for life. There needs to be some more emphasis on intervention at this point, because people involved in addictions will go to a rehab center, which is frequently not covered by insurance, and long-term rehab results are not outstanding. So it's a problem for families and for the person's career in their entire lifetime. So I'm all for what Raleigh is doing. Yeah, and emphasizing education and intervention in the younger age group.
Liz?
Raleigh, what will your role or public health role be in some of these strategies? You mentioned you're in this large group, but how does your role kind of come out in this?
Yeah, so SoundCheck, they work nationwide to really kind of look at school curriculum and have just a new lens to it and craft really these prevention, school-specific approaches. So they really are working most closely with Aspen Family Connections and the school district entirely. I'm there to just be a local expert in the data. My main role in public health is to educate and prevent and promote cessation of tobacco and nicotine products. So that is also where I am really closely involved with the school, making sure there's that intervention, prevention side of things, promoting alternative to suspension programs. I think that's super important, not just only for tobacco and nicotine violations, but generally speaking. So I am, like I mentioned, I'm just grateful to be a part of the project that Aspen School District is heading.
Linda?
Raleigh, how much parental involvement are you encouraging, or are you presenting to parents, at the high school as to what they can do to help their teenagers, because I think a lot of where they're getting the alcohol and maybe not the vaping, but the alcohol and drugs might be from, you know, they're from the parents.
Yeah, that's a great point. I was on a panel discussion that was open for Aspen School District parents and staff, and that was quite a few months ago. But I think having those yearly or at least twice a year at the school level would be great. And that was just really an informational session about what we're seeing and what we can do. And we had so many players at the table, not just myself from public health, but we had the SROs, we had Mind Springs there, as well as a prevention expert from Soundcheck. So I think the more we can do, the more outreach and communication, I think the better.
Catherine Sand always, says that typically you can provide all of this information and the folks that are gonna come and get it aren't always the ones that need it, right? And so how are we thinking differently about reaching those other community members or parents that might not come to some of these more traditional information sharing kind of venues?
Is this something that happens at back to school night? Like at the introduction, the orientation for parents on, the beginning of the season? It seems that most parents seem to take it more seriously when it's the first night or before their kid goes to a new grade. And I'm just wondering is that an opportunity then to speak? I'm thinking to the middle school kids in particular. I don't know if you've been able to make any ground with them, but back to school night, perhaps, if that's not when it's happening. If it's a special night specifically for this subject, I'm wondering if you may get a lower turnout, but if it's the first day back or the first night for the parents, maybe you can get more saturation if the schools will take it, put it on that level of seriousness.
Yeah, I think that's a great idea, and we'll definitely bring that back to our school partners.
Sorry?
What is our role in this as a community issue?
Probably, I'll take that one. So I think at this point, it's really being educated. And as we go forth and get better like concrete plans of what can we do about it, what's the school going to be doing about it, understanding what the funding mechanisms might be, right? Thinking about your role on the city council, thinking about the OCC, healthy community funds, and what we can work on together. But at this point, I think our roles really are understanding the data, information, education. Dr. Kurt's a big fan of letters to the editor and getting the information out there in other ways. But really at that board level, thinking about, the policy and education. So if there are, I know you all have been incredibly supportive of the tobacco policy, which is something that we know we can do that helps work towards these efforts. And I think we'd like to think that some of that decrease in vaping that we saw, it was really timed with a lot of the local policies that went into place. So when we think about the board role, it's really more of that policy level. And then when we do have opportunities to direct resources, how do we do that? And how do we make sure we're educated?
I would guess to say that this would be a priority issue for almost all of us. I'd also say that I think it's an area where impact would be doable because we really haven't had much impact in this area. At city council, we've had some interactions with citizens, community members who are working on, this is an issue for, let's call it the 12 to 18, middle school to high school years. Almost there. Over the last couple of years, I've come to recognize that this is an area that we are lacking in our community. Most recently, we put a lot of energy towards young child care and childhood education. But we really don't have anything for those middle years, those formative years. And kind of the area that we're talking about right now. So I know that from a city perspective, that the city and the city council are very interested in this as a priority issue. And we are looking for avenues to make impact. Along that line, what I would say is that some of the initiatives that we've been working on are community engagement. You know, I think we all believe that there's a level of non-engagement through community members and connectedness that we haven't seen in Aspen. That it's growing. That is a condition of community, and that it's growing. And so we've tried to formulate, for example, I think this is the first summer that we've done a Thursday evening, 4:30 to 7:30, family and child specific music activities, that kind of thing. And my point here is that education and outreach for this issue and for this age issue don't get it done. It doesn't get it done. So I think what we're really talking about here is a whole community effort, and really, you know, in whatever way that looks like a changing of the inherent attitudes is probably the way that we're going to be most effective. So anyway, I share all that because this is something that at city council and the city we do talk about. I think that the Board of Health getting involved in this and being a player and participant is fantastic. And I would love to see us do whatever we can as quickly as we can. And if we do anything, we can't do it wrong, because right now we're not doing a whole bunch.
Thanks for that, Tori.
Yeah.
Respond, Liz, go ahead.
I noticed your data from 2017, and so for those comparisons, and I think that the survey's been going on for quite some time. Do you feel like, I mean, I feel like this was alarming, you know, as much as it wasn't a surprise, it's still alarming to me. Do you think that how does it feel in the school? Is it a post-COVID phenomenon? Is this just something that has been kind of the state of the school for a very long time? Or what's behind all this in terms of, is this alarming to the school, or is this kind of like, yeah, we need to do something, we haven't done anything, trying something new? What is it?
Yeah, I can try to answer some of that. I think, you know, even looking back before 2017, some of those local data and results, they were higher than our comparisons, right? As far as COVID goes, I think, you know, personally, I would say that we need a few more years of data to see if there was that huge impact, for instance. But, you know, looking historically, there tends to be those higher numbers locally.
And Raleigh, I would add on to that to say what we're hearing from our school partners is that I think the substance use is just something that's traditionally been high for a year. But the mental health needs are something that are alarming. And I think that the school was definitely pointed to COVID as an instigator of a lot of those needs increasing. You know, there a lot of kids, right, didn't have contact with the school. There was a lot of things that changed home and family life, and then kids coming back. A lot of different compounding factors that were resulting in increased mental health needs. You know, I think a lot of what Raleigh's talking about is an effort to help address some of that as well, through some of the vital mental health services work and what we'll be talking about next. There are school counselors provided and counselors, mental health clinicians in the schools provided, and that has been increased from prior years because of the recognition of the increased need. And we know, you know, that we're still gonna have to figure out ways to address this. And then Tori, back to your point, I agree. I think at this point, we can't really do anything, you know, the more we can do, the more we can do. And I'd be happy to share with you some of the evidence-based practices that we know can help drive community engagement, can normalize these, you know, to help normalize events without alcohol as the center, you know, for them, and provide places for kids to go. You know, that's something that we hear from kids is like, there's nowhere that we can go to hang out and not, you know, have substances all around us. So Raleigh, I'm curious if there is a group of students at the school who's working on any of those areas. There's suggestions, because we also know if we're going to be trying to plan things for kids, it's always great to try to involve them.
Yes, I might not get their coalition name right, but last school year, there was a substance use and prevention youth group. I believe it was mainly high school students that was created, and that was in efforts with Aspen Family Connections, one of their youth connectors had helped kind of organize that. So I think that would be a wonderful opportunity to engage that group if they are coming back this school year, and see how we can collaborate with them.
You know, Raleigh, I was just thinking about the few moments in my career in high school and even middle school when something really touched me and affected me. And those were usually when people from the community came in and gave a presentation, like mentors came in. I can think of George Stranahan, when he came in and spoke to us about physics and cloud seeding and all whatever was happening in the day. And then Nick DeWolf, who was an icon in Aspen in his time here, came in and just transformed the lives of so many kids because he was somebody new. He wasn't a teacher, he wasn't part of the system, but he came in and showed enough care for the kids and made a presentation that struck so many of us. And there were a few others like that as well. Probably too few really. There should have been more. And I'm just wondering if there's any way that we could help with the schools in finding people, whether it's the mayor, I'd send the mayor in to talk to this, or anybody on the Board of Health who could go in and talk to kids. If the opportunities arose to have someone who isn't part of the school structure and the teachers and the admin from the community to come in and demonstrate that they're connected, that they care, and they have some information to share. I'm just wondering if that's something we could offer the schools. And then I'll sign everybody on the Board of Health up to come do it.
I think that's a wonderful idea, and I would be happy to make those connections. So feel free to reach out. I think to your point, Greg, of just having kind of that trusted adult, and it doesn't necessarily have to be in the school, which, you know, the training is provided for that. I help with that. It's sometimes youth just need, you know, they don't want to listen to their parents. So I think that's a great idea. And we're such a tight knit community. So I think that would be super beneficial.
Popped up recently, which I'd forgotten about because it's been so long, is mental health first aid training. And Krista Giesel and I think maybe Tina Anderson went and taught mental health first aid to a kids program several years ago, pre-COVID, thinking that if we could establish something like that to help give kids the tools to help each other and help themselves. And I'm just wondering, I think Aspen Youth Center was doing it for a while also, but I don't know what the status of that is any longer. Maybe it wasn't something they could measure, but might just be worth circling back. I don't know if that's your department or not, but I could talk to Catherine about it again too, and the youth center as well. I'd like to keep us moving because we are right on schedule. Thanks, Raleigh.
Thank you, everyone.
Decision from us? Do you need us to condemn this data or anything?
I don't believe so.
Compliment, yes, for compliments for the presentation. It was very clear. I'd like to have that slide deck to publish because I think the community should see this. We should be broadcasting this to the community. And so I'll plan on doing that. And, we're gonna move right along, so thank you so much.
You will send us.
Thanks, everyone.
I'd love to get it.
Something while the people are.
So right now, starting right now, we're going to the mental health access program. Jordan and Audrey are here to talk about it. We're on online.
Thanks, Greg. So I'll start to introduce the program and then we'll turn it over to Audrey and let her introduce herself and her role with us here at the County Public Health. So the mental health access program is something that we've really kicked off just this year, 2023. And it's a coordinated approach to serving individuals with mental health concerns across the entire continuum of care. There's two goals for the program. Oh, if you want to flip to the next slide, that would be great. One is to reduce barriers to access to mental health care, and then also along the way to be able to gather local data to understand the mental health barriers, challenges, and where our opportunities are, which are ultimately going to feed into a strategic planning process in 2024 to better coordinate and understand what we want to fund in terms of mental health services in the community. So if we go to the next slide, I can give you kind of the high level overview of the governance structure. As you'll see at the top, well, maybe it's kind of hard to read, but I will tell you that the program directors are myself and Lindsay Naish, the Human Services Director. So we're really working together to help organize and steer this program. We report to the funders group, which is made up of Pickens County, the City of Aspen, the Aspen Valley Hospital, the school district, Town of Snowmass Village, Rocky Mountain Health Plans, and the Sheriff's Office. So they are all agencies that are participating by putting funding into this project. And then really having a group help to give them recommendations. The steering committee really is the ones to help provide the recommendations to the funders about what services are needed, how that money, how it can be best spent, and what's needed in the community. Up at the top, you'll see the program staff that we've hired for a 2-year period to work on getting this program off the ground. One is Audrey, our mental health data analyst. And the second program staff is Greg Wolf, who is the mental health systems administrator and works in human services. So it's really a true partnership. The steering committee to this organization is really, you can see the mental health agencies that have representation on that committee, as well as the funders. So that's really a working committee who can really understand the operations and what the needs are, what might need to be done there. The operations team over there on the right-hand side are really the folks really made up of these case managers and clinicians who are directly serving clients, who are understanding what those barriers are, what those clients who are having barriers to care, who aren't being able to access mental health care in a timely manner, or aren't being able to access services that they need. They're coming together right now on a weekly basis to better understand how they can better coordinate. And then also at that same time, how are we capturing the data of what those needs are, and if there are service needs that we can't meet at this time. So even if we can't meet them, at least we're collecting that information to go into our strategic planning process. So that's the big picture idea of the mental health access program. It's a 2-year pilot program where we hope to really have some better recommendations after that strategic planning. So the goal is going into 2025 that would be really requesting some different services and aligning things a little bit differently to better meet the needs of the community. I'll pause to see if there's any questions before turning it over.
Only pause I have is I see Jenny's name all over this as well.
Yes.
Do you want to say anything?
Jenny.
How this works.
is our planning and prevention manager. And so in that role, Audrey will be reporting to Jenny in the PPP department. As you know, that department also is made up of Raleigh with the tobacco prevention work. And
Katie and Katie.
Katie and Katie. So our PACT program work happens within that department, as well as our health promotion coordinator. Currently, Audrey is still reporting to me because Jenny is offboarding her old job and training someone and onboarding some new staff. So that transition will happen in the future.
Got it. Great, thanks. Good to know. All right. Moving right along.
Okay.
Quick
Question. Yeah, go ahead.
Just having this chart is such a great step forward from where we've been over the last couple of years. A couple of years ago, for those that weren't involved in the conversation, one of the things that we talked about with mental health access was that we had so many wonderful organizations, but there was a lack of coordination and led to overlap, but also gaps that were not being filled. So even just identifying this like this and getting it to structurally start working together and listing the partners on the same page is such a great step forward. So thanks a lot. In the end, I think it's mostly gonna help the bottom middle box, which is what's important. So thank you for that.
Sorry.
I feel this is a superb diagram. I would suggest that it be integrated with either a contact telephone number or email for each one of those sources.
That does exist, but just not for y'all.
Okay.
Need to know basically. And thank you for that.
If you go to the next slide, I'll turn it over to Audrey, whose main role is really to help us understand what is the data that we need to collect? How do we get everybody in to be able to collect that data? And then how do we analyze it to be able to figure out what services do we need in the community? What do we need to be doing differently? Audrey, I'll turn it over to you.
All right. Hi, thank you guys. Can everyone hear me?
Yeah.
You can.
Okay, awesome. So just to start, I'll give a little background on my role. I was hired in April of 2023 to plan, develop, implement, and oversee a comprehensive data system for MHAP. My main role is going to be collecting data from organizations, both on a rolling basis and through our referral form, which I'll speak about later, but that's what we're using in case conferencing. And going forward, I will analyze and produce visualizations for a variety of audiences, including like this one or the steering committee or the MHAP case conferencing organization. And I'm really looking primarily at barriers to care. So these are situations and policies in place that prevent people from accessing the level of care they need when they need it in a way that is culturally relevant for them. Oh, if you could go to the next slide, sorry. So speaking about barriers to care, this is some data from a community mental health assessment that was completed before I came on board. But looking at the 3 most common reasons why individuals reported they wouldn't access mental health care even if they felt they need it. This survey was broken out into an English language survey and a Spanish language survey. And so I thought it was really interesting for both English and Spanish. The top reason was that they couldn't afford it. And then they both also reported that they found other needs were more important. But looking at the Spanish language survey, people reported they didn't feel it was necessary, whereas the English language survey reported that navigating insurance was too complicated and or expensive. So this kind of goes back to looking at those barriers to care and making sure we're understanding that they're not the same for every individual. If you could go to the next slide, please. So looking at how I'm going to collect this data, what I did when I first came on board was determining our data needs by working backwards from our big questions to the data that we need to answer those specific questions. So I was hoping that I could maximize the impact of the data while minimizing the ask on our local organizations. So basically using like one data point, like say demographic information for multiple different big questions. So we have 2 main data sources that I'm going to be collecting data from. These are the referral form for case conferencing. So when an organization wants to bring an individual to case conferencing, they fill out a referral form and we have that data in a Google Sheets. form. And then also I am beginning to collect existing client data from organizations. So I'll be doing this on a monthly or bi-monthly basis moving forward. And then below you can see kind of a simplified version of my process. So this is starting with a big question, which is what do we want to learn about mental and behavioral health, including substance use in Pitkin County? And then I go to the process, which is how can I collect this data? Who do I need to reach out to that might have this data? And is this even within the scope of MHAP? And then again, those two data collection sources, which are a referral form and data from organizations. Next slide, please. These are a few of the big questions that I did. I think there were 11 big questions that we're working backwards from. So the first one is who is currently accessing healthcare in Pitkin County. This is just to give us kind of a baseline that we can compare to going forward, which leads me to my second one, which is what trends are we seeing among those accessing mental health care in Pitkin County? Then we're also wanting to look at what symptoms or diagnoses need the most support currently. So based on just what we've seen in case conferencing, there's a lot of substance use concerns in the community. And so that's likely something we'll be focusing on moving forward. Fourth, we have what differences do we see between those accessing mental health care regularly and those accessing during a crisis? So a few of the organizations have what they call, it's a designation for either like a crisis touch or if they come in for a crisis appointment. And so by looking at the differences between those individuals and those who are just accessing regularly, hopefully we can find ways to divert people from crisis care and getting the help they need before it turns into a crisis. Again, looking at what barriers are preventing people from accessing mental health care. Then we have what are perceptions or stigmas around mental health care in Pitkin County. We're likely going to have to administer a survey to find this out, but that's another source of data I hope to be able to analyze going forward. And finally, we have who is falling through the cracks. So this is going to be a longer term question because we can't know who isn't accessing care at all, but looking at who is entering care but then not maintaining care, that's one way. And then also working with law enforcement and PACT to look at who is being contacted but not accessing further care. Next slide, please. So the methods for this collection, as I mentioned earlier, we have kind of three. So survey for perceptions or anything else that comes up going forward. This referral form data from the case conferencing, which is a weekly basis. And then monthly or bi-monthly reports from organizations, just depending on what they're able to do. And then I also have been transcribing the weekly meetings, looking at recurrent themes, learning opportunities, and then creating a resource library of things that come up each week. And on the right there is just a super short list of the data we plan to collect, looking at kind of basic demographics, SOGI information, employment status, insurance status, kind of the usual things. Next slide, please. And then finally, for me, how this data is being used. So the first one is coordination of services. So we are doing these weekly meetings with service providers, and it's really illuminating additional services available in the community, as well as gaps in the community, and it's creating a better coordination of services, just really fostering these conversations where all the organizations come together. It's been really enlightening to see how much is available that people just weren't aware of, and just seeing the organizations help connect the other organizations to those. We're also doing provider education. So each week, I mentioned I'm creating a resource library as opportunities arise. So this is like lists of organizations in the community looking at IOPs that are available, things like that. And then every week we're holding a 15-minute space at the end of the meeting for educational opportunities where an organization can bring something they want to educate other organizations about. And finally, this data will be used for strategic planning. Like Georgiana mentioned, beginning in January 2024, we'll be using this data to inform strategic planning around mental health service gaps and the future provision of services in Pitkin County. And I think that is it for me. Does anyone have questions?
I just wanted to ask about the workload. It sounds like it's pretty labor intensive for anybody who's coming to the weekly meetings, and how many people do you anticipate being at a weekly meeting? And you know, is this going to be a heavy lift to require more employees to gather this data? what are we thinking?
Yeah, so I think our average meetings have had, I think, between 12 and 15 attendees. There are a few mandated attendees that are at every meeting, and then others as they're available. There is, obviously, anytime you're asking someone to create a report every month, there is a little extra work, but we're really focusing on ensuring that we're not asking for them to create like a whole new workload. So I am meeting with each of the organizations over the next month to ask about what they're already collecting, what they're already reporting, and seeing what we can do with that data rather than asking them to create a whole new report.
Yeah, thank you. Liz,
So going back to the chart, yeah, there would be lots of organizations in different boxes. There's a different person that represents up here and a different person that represents down there from the same one. So there's multiple people from each organization participating.
Exactly, at various levels. So the folks in these weekly meetings are like the people who have direct understanding of the cases and the clients. Then the steering committee is probably more like the managers of those folks, so they have a better operational idea, but maybe don't know each individual case that's going on. And then at the funders level, right, it's just that high level, Sarah Ott is there for the city. So high level to make those budget decisions, but really are going to be relying on those recommendations that the steering committee will be providing for them.
This is a great high level overview. I'm gonna dare to ask a very lower level specific question. And it's my own fault for not knowing the answer to this because somebody told me just this weekend, but I forgot. Anyway, this past weekend, I actually did the Mayor's Cup golf tournament, and it is a benefit for mental health. The two main recipients for the funds that are generated are the Aspen Hope Center and Aspen Strong. Aspen Strong is now called Headquarters. And when I was doing it this year, I was interested in these funds being very much used for as much of the community as possible. And so I identified Aspen Strong and Headquarters as a kind of an umbrella organization that really tries to facilitate counselors and services in the valley. Correct me if I go wrong somewhere, and Audrey as well. And one of the things I asked was about that the ability for the client, the person that's in that bottom middle box, to access funds. If funds are the barrier, if cost is the barrier, do we have a program in our community that somebody could literally say, I know that I would like to talk to somebody. Can I get help? Headquarters said something to me, and this is where I should have remembered better, that there was a community fund for that, and that they have it now resides with them. So I'm correct so far? Wow.
They, the Aspen, Community Foundation, thank you, used to administer the mental health fund for the community. That has since transitioned to Headquarters. And so any fundraising that happens, as even through Aspen Community Foundation, it all goes to Headquarters to figure out how to divvy that out. And so there is a fund, there are some I'm forgetting the amount right now, but I think it's a pretty meager amount in comparison to the comparable funds in Eagle or Summit County that exist. And we're trying to thread the needle between just folks saying, I need mental health care, this is a therapist I want to see, I need community support.
Sure.
And also understanding, are there any other programs that you might qualify for that are already paid for, or, would be free to you, so that we can get the biggest bang for the buck out of that mental health fund. And so what we're finding in some of these coordination, the mental health access program calls, is that there are programs through Medicaid, there are programs through all these different folks that are sitting at the table that help bring services in, that a lot of folks just don't know about. right? So like Triad, EAP, or some of these other things. But there is that fund, it does exist, and we could raise funds to have it be even more.
Well, hopefully we did discuss you. Then for the client, aside from giving them your email or phone number, if somebody came up to me and said, you know, I'd love to talk to somebody, but I really just can't. Would I say contact headquarters? Yes?
So headquarters, the headquarters administers the fund, alternatively, sometimes if they're already like seeing a provider, there are some providers who accept the mental health fund. The provider can make that connection as well.
Thank you so much. Appreciate it.
So Aspen Strong is now.
Correct.
Okay.
Great. I was just gonna say, Audrey, when you're working with all these people, collecting this data, one of the questions I would recommend asking is just a check in at the weekly meeting, just to make sure that there's the fatigue factor from additional meetings or additional time or additional work needed, just so you can keep a thumb on you know, how are people responding, and the quality of the responses, you know, maintaining a high level. Just so you have a check-in with them, because it does sound like a heavy lift for some people. They've got to be there every week for an hour. That's a big chunk of their day. It's important stuff. They want to make sure that everyone's taking it as giving it the attention it needs, but it'd be good to know if everyone's okay with it ongoing.
For sure, and we're actually, sorry, just I'll say last, we're actually doing a survey. I started drafting it today, and it should be going out next week to check in with people, making sure this format's working, that it's not too much of a lift, and seeing what we can do to make it easier going forward.
Wow, great.
Yeah.
You should pay me to ask questions.
I would love to point out to the board fun facts that Audrey was an intern with public health before being hired for this position. So just making a note that those internships not only pay off for the community, but they come back to benefit us. And also just on the hiring front, because the position that we were looking for to analyze all of this data was such a unique skill set. We weren't successful in finding any local candidates, and so opened it up to be a remote position. And then we're able to find Audrey. So that was one way that we were able to help meet that need.
Great. Well, welcome, Audrey, and this is great. That's glad to hear it. Thank you so much. I'm gonna keep us moving.
I just have one more question.
Yeah, sure, Linda.
George, Aspen or headquarters, do they have a Spanish speaking individual in that that help any Spanish speaker who is looking for funding?
I'm not sure about that. Is their directory available in Spanish as well, or just? I don't know. So they have an online directory that is, I think more of the idea is to kind of let folks explore that and make connections. I'll check right now and see.
Yeah, I'll do it. I was doing the same.
I'll check and I'll let you all listen to Kurt talk about PFAS.
All right, switching gears. That's what I love about public health. It's very broad. So I get to talk to you today about some chemicals, a group of chemicals that have been in the news that are associated with some negative health impacts. And I believe we've discussed this briefly with the board, maybe as a round robin, but we had some questions and asked to do a more formal presentation. So some of you may have heard a little bit of this, but I know that happened years ago, so some of you may have not. So we thought we would start from the beginning again. So I know it's chemistry and chemical stuff. There's a great selection of sugar in the back if anybody needs any of that. That was awesome. So next slide, please. So PFAS is a group of chemicals. also known as forever chemicals. Poly or perfluoroalkyl substances, it's a big word, right? PFOA and PFOS are also part of that group. Those are just specific subgroups of that. PFOA and PFOS are the most commonly used of the PFAS chemicals, and so they're the most studied. But a lot of times you'll see those two called out separately from PFOAS, although they're still part of that group, still of concern. So these have been around since the 1940s. You'll hear a lot of comments about the most common place that we see these are in types of firefighting foam. However, they are all over the place. They are in ski wax, although I don't believe, last we checked, you can't get ski wax with PFAS in it in town anymore, but some of the older ski wax has it. You can also find it in non-stick cookware. Anybody has Teflon cookware? That has PFAS. You can also find it in stain-resistant treatments or water-resistant treatments. If everybody here has like jackets with DWR,
I'd like to
that has
comment,
PFAS.
they're present in foams that firefighters are exposed to, whether at the airport.
Right.
That's right.
He's right. And firefighting foams were the biggest use, but the reason I bring up the other uses is because as a forever chemical, it actually has been found not only in urban areas or areas where we have firefighting foams, but it is actually being found in rural water systems. And that is a really important piece because there has been a lot of take of, well, we don't have that, so we don't even need to bother looking at PFAS as whether in our water. But the concern is PFAS, the major concern we have is if you consume it, it has negative health impacts. If you want to go to the next slide, or next slides are dead.
I am trying. My computer just turned off by
Oh,
itself.
okay. So
I'm getting there.
why do we care about it? Because it has been found now in the environment. It's been found in both water and food. And it also is used in clothing, but again, the major concern we have when it comes to health is the consumption aspect of it. So the health impacts that we have seen associated with it, we've seen higher levels of cholesterol, reduced vaccine effectiveness and some other immune response suppression, as well as some associations with cancer. So now, the important thing over those health effects is those are a long-term exposure effect. It's not a short-term acute effect, but a chronic exposure, so long-term. So you think long-term here, it's not, I have PFAS in my water and it's an extended period. And that's a really important piece to remember as you think about how any exposure might affect you and your health. So, so go to the next slide.
Next slide.
Thanks for.
Yeah, sorry about that.
The people we're most concerned about are children 0 to 5, pregnant women and nursing mothers, although these impacts can be seen across the board for most people. But those age groups are the ones that we're focused most on because most of those impacts are seen here. The other piece is PFAS is an emerging concern. There are still a number of the chemicals in that group that haven't even been studied for health impacts. And the ones we have are pretty limited in value or limited in information. So we're still researching more. And so as we learn more, there may even be more information that we'll come back and let you know about. So go ahead to the next one, please. So because of these health concerns, you've seen a number of actions taken. Right now, PFAS and those chemicals are what's called a secondary contaminant. And I love the EPA because this gets really confusing. There are primary contaminants and there are secondary. And most of us are familiar with primary contaminants. An example would be lead in drinking water, lead in soil. We have standards that you have to meet. And then there's regulations. If you don't, there's enforcement actions that can be taken, right? PFAS is what's called a secondary contaminant. And so there are health recommendation levels, but there's not an enforcement component to it. So they recommend it. And that's a lot of times what you're seeing are chemicals that we just don't have enough information to make that a jump from a secondary to a primary because we don't know the health impacts, or their health impacts are so less that they're not as a concern as some of the primary ones. Right now, the EPA is moving from this being a secondary contaminant to a primary contaminant. So they've made a recommendation. so that they have a standard that they won't be enforceable. What they're proposing is that for drinking water systems, they're gonna have a 4 parts per trillion maximum that they can enforce. I love this, and I love talking to the group about this because 4 parts per trillion, that is a really small amount. And we've talked about parts per billion before being a drop of water in an Olympic-sized swimming pool. Parts per trillion is even smaller, right? So that would be like if we decided we were gonna take a trip to the sun. It's 93 million miles away. 1 part per trillion would put us at about 6 inches along that path. That is how small part per trillion is. And that is one of the challenges with chemicals, and especially something like PFAS. When we look at health impacts, we are talking about very, very small amounts over a lifetime exposure can cause health impacts. And so addressing that becomes somewhat difficult, and we're still working through that process of doing that. But obviously the, 4 part per trillion piece is very small. And so the question becomes, how do we then limit our exposure? Either the preferred goal is actually 0. We would rather see people not exposed at all. So the EPA is working towards getting an enforceable policy so that we can work with getting systems tested and working on getting those systems that might have that impact cleaned up more soon. CDPHE then had funding. It closed in March of 2023 for water systems to go ahead and start testing for this, recognizing that we're going to have a standard in place from the EPA, starting to understand who may or may not be in compliance with that is an important piece. And so CDPHA put out grants, not only for testing, but also to help with infrastructure and helping facilities that do have this, or individuals on an individual level to actually address that by taking it out of the water. You can filter it out of the water. It takes some effort. And we've got a link to a slide here later that we can talk about. So when CDPHE was doing grant funding, we were actually Picken County. We solicited all of our water providers to say, hey, here's this great opportunity for grant funding to get this done for free. Unfortunately, we did not get a lot of takers. And again, one of the reasons that I bring this up is when I talked about the attitude that rural areas didn't think they had this because we didn't have firefighting foam issues and we had this association with firefighting foam, they were thinking, doesn't impact us, not a big deal, we're at the top of the water system. I'll show you a slide in a little bit, but that actually isn't accurate. And there is a link in the slides to an article. Frisco in Summit County, the town of Frisco, discovered that they had PFAS above this proposed limit already. So there's a rural area. Eagle County has now done some testing, and Eagle Watershed has found it. So there are a number of examples of rural small water districts where you're seeing this PFAS levels above what the EPA is proposing for standards. So it isn't just an urban piece, which I think was a lot of misinformation there, or an airport piece where, you have firefighting foam at airports, although again, not all firefighting foams have it, but a large portion of what was used did. So we're continuing to encourage people to test for it. When the EPA does have this standard adopted, I believe it will be in 2024, there will be a requirement for people to test. So right now, we're still promoting it in the meantime, just to get people in the front of it so that we can understand if we have any issues there. So, do you want to go to the next slide? So here's a sampling map, and this is the entire state. And I wanted to show you this more than anything else. There are a number of different pieces on here. These are either people who have tested and either are in compliance, out of compliance, or are in the process of testing. And the important thing here to look at is all over the state. All right, again, to reinforce this idea of this isn't just a metro issue that's up and down the Front Range. We're seeing this in a number of different places, including rural places. And then you want to go to the next one. I zoomed in Picken County. We've had 3 places test. Aspen did, it was below detection limit. All 3 of our facilities that have tested are below reportable, the required or the proposed required limit. So, White Horse Springs, the city of Aspen, and then Prince Creek. And Prince Creek is, as you're headed south in Carbondale, just as you cross the county line back into Fulton County there on the east side.
Did any of them measure zero?
You know, the way the state reported it, it didn't say zero, it just said below the threshold. So, yeah.
I have a question about the soil at the airport, because there have been so many times that foam has been used with crashes. Plus, in training, firefighters are using foam.
Right.
So particularly if the soil is gonna be moved with runway expansion, where will that soil be dumped? And because I think it's sort of like the soil from the Smugger lead contaminated area, you have to deal with that very carefully.
Right. It's a very good point. I think we haven't gotten the aspect of following up. I did have a conversation several years ago, pre-COVID, honestly, when this was first emerging with the airport director asking that question about firefighting foams. And at least at the time, he believed that they had not been using the foams that had PFAS in it. Now, I don't know how far back he went with his history. I think it's one of those questions that as we are able to get more people in line with testing, it's probably something we need to include and just see if we can see if there are trace levels there. But I don't have a great answer yet, but I think that's a follow-up question we're gonna have to answer.
I'm dealing with the IAFF, or the International Association of Firefighters, on a regular basis because I review cancer cases for them and that kind of thing. And I started this when I was reviewing firefighters for carbon monoxide years ago when I was back in Boston. So I know that they have policies dealing with PFAS, and there are substitutes now that are PFAS free and foam, but they're not as good, but they're using them. They've been available for about the last 18 years, but it's sort of optional for each fire department of what they're using at the present time.
Right.
So it's a concern, because the more we learn about this, the more dangers are currently associated.
Absolutely. Can you go on the next slide? Is there, so we didn't want to leave with that information, the piece that really, where did you?
Yes. First of all, I just want to say I am endlessly shocked by Dr. Kurt's sphere of involvement. Like, I happen to be consulting with the International Firefighters over the last week. You're amazing. It is the truth. I know that's what's amazing about it. My question was, if you're talking about water supply, like creeks and the like, are you testing the water or the soil? Like what, how is this?
Right now, what we're testing is the water. Right, and I'm not familiar if we've gotten to the point where we're testing soil, because you're not consuming the soil, and again, that's the major path we're worried about. It may be that at some point we're looking at the soil, if there's water contamination, trying to understand where the water contamination is coming from.
Yes.
So right now, we're just in a place where we're trying to figure out who has water that's contaminated or not, let alone the source of that. That makes sense?
Yeah.
Is it, I'm sorry, is it true that 45% of our water sources have it, and we haven't even touched the surface as far as actually testing all water sources?
And yes, we have not come close to testing all our water sources. I have heard a couple of different numbers. I think the important thing is that it's definitely been found in a number of water systems. And again, for us, this is something that could be here just because we had 3 systems that we tested and they all have come back below that limit, doesn't mean we're not gonna have any.
Right.
Right, and I think encouraging testing is one of the pieces that I think is gonna be the most important part. We've done it, but I think it's gonna take a community effort to really get everyone else on board. So, John?
I think, we're aware of, the poor quality water that's available for residents of mobile home parks all across the state. I'm not sure if PFAs show up in, wells or anything like that, but I know that, it's a huge issue with our mobile home parks, and a lot of the people who live there are mostly Spanish speaking and oftentimes afraid to even complain about their water.
Right.
Is there any effort being made to test their water?
Yeah, and I know the state reached out specifically. I know one of the groups that took advantage of the grant is the mobile home park in El Jebel. But Eagle County Mobile Home Park, I believe, in Basalt there. I think I said that right, you did, Ken, but the mobile home park in Basalt was on the list as well as needing to test. I think there's been an effort, but I think there needs to probably be a greater effort because we know that those communities can be impacted even greater. And we see all sorts of issues. The other piece that I want to point out, because with other water contaminants or questions with water, especially when you talk about mobile home parks, people will buy bottled water and not consume their tap water. Right? The problem is that some bottled water will have PFAS in it. And so you need to be able to read a label. And bottled water is an expensive way to get your water to begin with, and that has even other financial impacts.
Especially on
On a limited budget already. So, I think you're going to continue to see greater efforts around that while mobile home parks, especially because of the issues that you've seen with things like environmental quality and water being one of those. But I think, trying to get testing is probably the first piece that we need to do so we can understand that problem. And so, and when we talk about what to do, knowing what's in your water is important. And every one of us that isn't on a well, and wells, we're part of this aspect. If we're on a private well, you could get grant funding for this. Again, it sounds like not a lot of people did, but it can impact groundwater. So even if you're on a private well and not on a drinking water system, it's something you probably should at least be testing for.
What would you see on a label of a bottle of water that would let you know it was in there?
I believe it is required to be reported. That's a great question. I will have to follow up and see if I can get you an actual image or an example of what it would look like.
I can't imagine they would advertise it in there.
No, and again,
This water may kill you.
Yeah, right. It should say something like PFAS free is
Really?
what I would expect it to say based on, but I need to pull up an actual example and get it to you. So I'll give that to Jordana to share with you.
I shared an article with Jordana, which maybe they could share with the board. It's a year old from USA Today. It quotes the EPA. And the gist of the article is it's unsafe to drink rainwater around the world because of PFAS, and they are appearing virtually everywhere. So I'm not sure that we can test as much as we need to filter. It'd be good to know if there were more concentration. It sounds as if the concentration, the minimum was 70 parts per trillion. Now it's down to 4 because they realized that 70 was still unsafe. So I'll take a look at this article, which is pretty daunting, but it makes me want to spend less time wondering if it's in the water and more time trying to figure out how to filter the water.
And I think that's a good point. I think one of the pieces that I'm learning is we're coming up with new technology to filter out PFAS in water, where a year ago we were really still talking about a reverse osmosis system for households, which is expensive to operate, expensive to maintain, and isn't cheap to put in the first place. So that's not a realistic option for a lot of people in the world. So one of the things that there's a link in these slides to, and I've noticed that now there's some recommendations on water filters, one of which you can actually put in a pitcher for pitcher water and it will take PFAS out. But in terms of consumption, I still think it's important that if we're on a public drinking water system, we all get a flyer every year required by law that tells us what's in that water. And if they have measured it and it is above, they do have to report that in that. So one, understanding what's in your water, even if it's not PFAS, even if it's anything else, you should always have a look at that and make sure that everything is there. There are additional requirements if they're out of compliance, and you would see additional ones as well, but it's always a good thing. If your water system hasn't tested, encourage them to test it. I think that's a big piece that help us because we've been encouraging it and it's fallen on deaf ears, but I think a lot of people need to realize it. It isn't just in firefighting foam, it's in all sorts of things, and there could be a source of contamination that you didn't realize. So check it out.
How is our local water supplier doing? The Aspen Water Department or the Snowmass, kind of Snowmass water, they must be up to speed on this. I'm sure they're monitoring it. Do you communicate with them?
We communicate with them. We've made a communication effort with all of our water providers. So we got that list of information from the state health department late last year. So Aspen has tested, they're on that map that I showed you in there below detection. Snow Ash Village did not show up. So if they've tested it, it's not been reported to state. Right, and that's about the best way I can say that. They may have, we just don't know. So, there will be a continual outreach both by the state, and I think, we'll continue to reach out and make sure that people recognize that this is gonna happen, especially as the EPA gets down their path for adopting a standard, and then they're gonna be required to comply with that standard regardless, and we'll need to know that, so.
Do water providers, put what's in their water, like on their website, or is that something you have to specifically request that information? Can you find it on a website?
It's a great question, and I know I've looked it up on their websites, but I don't know if there's a requirement to post it, and I would have to check. I know you're supposed to get something in the mail every year from them that tells you what's in the water. You usually get it it's their annual report. And they are required by law to do that.
Okay.
I can check and see if they're also required to post it online, because a lot of us miss the annual report. I know, like I did with our water system, I haven't seen it, so. The other interesting thing that I found out, again, it can accumulate in fish, and reverse of where we are concerned about, large ocean-going fish for things like lead and mercury. It's actually freshwater fish that can accumulate PFAS in their system. So if you consume a lot of freshwater fish, again, there's a possibility. I talked about Teflon coated pans. I have overheated a few of those pans in my lifetime, and that Teflon will chip off. And if you're consuming that, that's an issue. So if you haven't and you can, you should be thinking about replacing things and have that in it. And then Dr. Kurt, to your point, you talked about a little bit about in the firefighting foam. The state of Colorado is putting a ban on PFAS in consumer products. They're phasing it in. It starts in 2024. And it's a series of chemicals or a series of products, and it goes all the way through 2030. And then there will be a ban, and I believe it will be a complete ban at that point, but it needs to be phased in. So you'll see these things where firefighting foams won't have it anymore. DWR. And DWR, like you talked about firefighting foams, it's not quite as effective. It's not quite as durable, but it will be.
But these are called forevers.
Yeah, they're called forevers because they don't break down. Yeah.
Well,
So-
I can recall being out there at mock disaster drills when they spray a little foam just to demonstrate it. So it's not necessarily at a crash, it's used in training.
Well, and that was, I grew up in Colorado Springs, and the first place that we really saw a big issue with PFAS was Whitefield. And their aquifer under the town of Whitefield, which is South Colorado Springs, was contaminated because of Peterson Air Force Base. And all of the firefighting training that they did there, and they just readily sprayed those foams and they got into their aquifer. And so we've seen some large scale examples of that exact thing.
Particularly in Air Force where there are hydrocarbon fuels involved.
Right. Right.
I need to keep this moving along. We're falling behind my agenda schedule. But I did want to say, are we going to reach the point where we want to have an advisory, a public advisory that just goes beyond this conversation for the public on this topic?
I thought about that type of an action.
No, but I think what I will be bringing to the board at some point next year as we focus more on our communications and that we have Katie in the health promotion role, we'll have some more capacity to do some more community outreach. And so the board's brought up a lot of different ideas of things that we might want to focus in on. So the board might have some input in thinking about what should those outreach topics be over the course of 2024 comes next. And that I'll put that on the list of something that we can vote on.
While we're at it, it'd be nice to have a source of filtration equipment, whether it's for your home or just so we can give people useful advice on.
And it's in this presentation, so I will send this out.
Yeah.
Great, thank you. I'm gonna keep us moving to, this is an important topic. So we've got to get to respiratory disease update. We've all been hearing about the COVID that hasn't gone away or is coming back. And Carly is with us for that, right?
Yep.
Where's she?
Yes. virtual. So thank you guys for having me. I know that this has kind of been a hot topic for the last couple weeks. So thank you for the opportunity to speak to y'all here. Next slide. All right, just sort of wanted to start with sort of a brief synopsis of what is going on currently with COVID-19 nationally as well as within Pickens County. And so as many of you all are aware, and as we've kind of heard anecdotally, we have seen a increase notably nationally in testing positivity. So that graph on the right-hand side, that orange bar.
You might have to be closer to your microphone. It's kind of hard to understand. Sorry.
No, sorry. I can, if you're having a hard time hearing me, I can pop over and put a headphone in too. So holler if that helps. So that orange bar on the right hand side of that graph is from the CDC. We can see that quick and sharp uptick in testing positivity is really sort of one of those ongoing evergreen metrics that we'll be using going forward, very akin to sort of how we utilize flu testing positivity to help kind of indicate when we're seeing increased rates of activity. So again, that's the national picture, and just really want to highlight that this is very similar to what we've seen over the last few years, is this kind of late summer push in activity of COVID-19 circulating across the country. So just want to note that there's nothing new to this. This feels very similar to what we've seen in years past. In fact, we are actually seeing generally lower rates of hospitalization and lower severity of illness than we have in years prior. So even this summer, even though the trends are similar and that increase of activity is certainly occurring, there is nothing incredibly alarming going on across the country as it stands. Just want to highlight as well that map that's underneath, that is wastewater. So those are sampling sites across the country that have data available for the last 2 weeks. And just want to highlight that many, if most, are experiencing some level of increase across the country for sites that have reported. And I'll also want to just note that the CDC stated that there's only about 50% of sites that are reporting data in the last 2 weeks across the country. So just want to highlight that there's some variability and some, change potential in that data as more sites come online and as more sites submit data. But that, again, this is very akin to what we've seen in years past, especially as a country. In fact, this is even less alarming than what we've seen in years prior during this time. So what that functionally means for Pickens County is that we have seen an incredibly mild or moderate increase in cases being reported to public health. Just want to highlight 13 in the last 31 days, 8 of which have been during the last 14 days. We have seen an increase in hospitalizations. We've been working really closely with Aspen Valley Hospital, who's as ever an incredible partner, and has been really communicative with us per sort of what they've been seeing. And just want to highlight that a vast majority of these hospitalizations that we have been seeing have been in out-of-state visitors. All of these hospitalizations have been within these higher risk categories as it pertains to either age, so 65 years and older, and with high risk medical conditions or complex medical histories. So not only are a vast majority of these hospitalizations from out of state, notably actually from lower elevation areas, but that a vast majority, all of these individuals have had these pre-existing and higher risk conditions. So even locally, we're seeing very similar trends that the nation is seeing, which is lower hospitalization rates, even though it functionally for us, right? For Aspen Valley Hospital, it doesn't matter where the county of residency is for the individuals seeking care with them. So I don't want to say that they aren't seeing an increase and that they aren't seeing that increased strain on their staff and their kind of work towards COVID-19, but that this falls right in line with what we're seeing kind of nationally, and that big picture, we're not super concerned with the severity of illness that we're seeing circulating at this time, even though we're still very cautious and aware of what Aspen Valley Hospital is going through. So that's just sort of a quick little snapshot of what we're seeing. Any sort of immediate questions on this, or is it okay to kind of roll on?
Let's keep rolling.
Perfect. All right. So why are we seeing summer surges? There are a few sort of leading theories as it pertains to why these summer surges continue to occur. This season in particular, I do want to call out the impact that these severe weather events and climate is having. This in particular for this year is a leading theory. And so Leon et al. This year ran a meta-analysis over the last couple of months showing that the heat wave that's being suffered, not just in the United States, but also globally, right? We're seeing global impacts due to change in weather patterns have actually been a primary driver for COVID-19 cases and has increased cases by up to 67%. So for North America, what that means for us is you can really see on the right-hand side that map that is testing positivity. And so all across that kind of heat band that the United States has really been suffering through that heat wave for the last month of July, that's really where we're seeing that larger increase in testing positivity, which again is one of those metrics that really shows sort of where there's that increased rate of COVID-19 circulating. So this is one portion of the puzzle, right? I'm not saying any one of these is the reason that we see these summer surges. It's mostly discussion on all of these come together to kind of increase susceptibility and increase that COVID-19 activity through the summer. So waning immunity, we know that there's pretty strong data now to support that these vaccinations and the boosters and even natural immunity to naturally occurring infections, all of that protection tends to wane pretty significantly after 6 months. And this varies, of course, by variant and each individual's immune system. And so waning immunity plays a big role in this. We are about 6 months out from when a vast majority of individuals sought that last booster dose or when they become eligible for that last booster dose. This can also be thought about. We're about 6 months out from the peak of that winter surge that we see in cases. So regardless, overarching community levels of immunity decrease roughly 6 months after. To go hand in hand with this, and it's a slightly different mechanism, even though it's relatively similar, is that COVID-19 is, as we know, highly mutagenic. So what we're seeing out of the variants that are circulating currently, it is a vast majority of them are subvariants of XBB, which is a variant that we saw circulating widely in the winter. But really just want to call out that graph on the bottom is the variant tracker from the CDC, just to show how diverse COVID-19 is at this point in time. And so it really has branched out and morphed into all of these different sublineages. This is very similar to what we saw last year when we had co-circulating BA4 and BA5. So again, this isn't anything new. This is just to show that if you were if you became infected with XBB over the winter, chances are that some of these subvariants have mutated to be able to evade your immune response, and that you may be just as susceptible to contracting COVID-19, even if you had it fairly recently. So just want to highlight these three together, all sort of come together to create these midsummer surges. Next slide. And then what this means for Pitkin County, really. I want to kind of bring it back down to scope, and that COVID-19 and the data that we're looking at currently, it is all about scale and trends. Wastewater going forward is, of course, this incredibly powerful tool. But I know we've talked about this in the past, but really just want to reiterate that individual data points can be incredibly misleading. Individual data points for our wastewater are so dependent on our traveling population, are so dependent on community events that occur, holiday weekends, and don't explicitly mean that there's more COVID present within our population at any given point. So how we look at wastewater analysis really looks at how do we compare to years prior? Is there any sort of relative event that occurred? So for this instance, within this conversation, we can look a lot at July 4th, right? So those two spikes that we see on the right-hand side, the top graph is from Aspen, the bottom graph is from Snowmass, and we see the little blips a few kind of data points ago. Those were both sampled within 3 days of 4th of July. And so what that means for Pitkin County is that those aren't explicitly saying that there's more activity of COVID-19 amongst the population. We know that 4th of July weekend is one of our busiest that we see all summer long. So it's really challenging to look at that data data point and be able to say anything as it pertains to this 4th of July and this sort of slice of COVID-19. What we can sort of look at is the scale. Where were we in comparison to last year, where we had more robust testing, when we knew that there was a lot of COVID-19 activity amongst the community? And if we look at these little blips and this summer, where we've had functionally that flat line for a vast majority of the summer, and now we're getting sort of this ever so slight uptick over the last few data points. If we compare that to last summer, we can really see that scale is dramatically different. And this kind of is supported by the amount of cases that we're seeing and the amount of hospitalizations that we're seeing. So just to reiterate, we saw 13 cases in the last 31 days, and just want to acknowledge that this is, of course, with greatly reduced community testing options. But this is compared to roughly 200 cases that we saw over the same time period last year. So the scale is very, very different. Are we seeing an ever so slight uptick? Of course, but it is, even wastewater is not showing dramatic increases, even remotely similar to what we saw in years prior. So scale and trends. Did we see an uptick after the holiday and over July? Of course. Is there more COVID circulating? Of course, but it is at such a lower rate and a lower magnitude than what we've seen in prior summers, as well as prior seasons. So want to take that with a grain of salt. And then just to reiterate that.
We lost you. You froze up on us. Carly, you froze on us. I don't know if you can hear me. I think she was approaching the end of it there, but I'm not sure.
Yeah, I think we just wanted to make sure that everybody remembers that we still have the same tools at our disposal of staying home when you're sick, staying up to date on your vaccinations. Masks are always there. If wear them when it's appropriate for you. And test if you think that you might need to seek treatment for COVID-19. There still are treatments that.
Are you making an announcement on the new vaccine that will be coming out in the 3rd week of September? I think both Pfizer and Moderna are going to come out with the XBB 1.5. Will that be done strictly with community health services and doctors' offices, or will the state have a bus, or what will be happening?
So, yeah, COVID vaccines will be available wherever you can get other vaccines, which is great. So you can go to your doctor's office. I don't know if CHS will be offering those. We'll ask Carly what their plan is to offer those to the public. And then
I believe CHS will be offering them. But as of, I think it was August 1st, the state is no longer doing state programs for COVID vaccinations. So it's my understanding. So it will be, through physician offices, health services, everywhere else that other, flu vaccines will be offered.
But they are talking about doing a bus.
The bus is still, we're looking at the bus, although on some level the bus is going to be focusing on childhood vaccines, with respect to COVID. I think the other challenge that Carly and I talked about, the minimum ordering may become an issue as well. There hasn't been a discussion on what the minimum amount that can be ordered. And so for us being small provider, having a number of small providers, that could end up being a barrier. We'll just have to see that information has not been released yet, but that is one of the things we're worried about.
And then Carly's she's got one more slide here just to give the board a heads up on what metrics and data around respiratory diseases and COVID is going to be looking like.
And I'm so sorry about that. I don't know what happened to the computer, but it had a bit of a moment. Sorry, thank you. I'd love to talk a little bit about vaccines. If you guys had any questions, happy to kind of address. But for the data, is just wanted to highlight sort of some of those metrics that we've used in the past and what that looks like going forward. So case counts and incidence rates, I know we've already kind of touched on, but these are truly no longer incredibly accurate. Just because we've seen those handful of cases, we are well aware that there is COVID-19 activity throughout the community that we are not aware of. So case counts strictly and incidence rates are kind of falling by the wayside. So just want to kind of highlight that. Testing positivity continues to be a really powerful tool. akin to what we see with flu, and that flu testing positivity is really critical for identifying when seasons are occurring and when we see that uptake in activity. And so testing positivity will continue to be utilized. Hospitalizations in that same vein will continue to be utilized going into the future. But I do want to highlight that the cadence of data updates specifically for hospitalizations and testing positivity has changed. So we used to have daily updates from the CDC and CDPHE. Currently, it is now reduced down to weekly, and I could foresee a further reduction as we kind of move into the future of what endemic COVID looks like. That being said, hospitalizations continue to be powerful and really insightful for especially determining severity of current variants that are circulating. And then the big one, wastewater is, as ever, a incredibly powerful tool. We're really grateful to have it, and we will continue to monitor it. But just again, want to always have that asterisk of individual data points for wastewater can be misleading. It doesn't always mean what they think it looks or what we think it means, and that wastewater should always be taken with a grain of salt and looked at as trends and excuse me, and in comparison to prior years or prior seasons. And so just wanted to highlight those are live links that are on the bottom of this slide. These are the best up-to-date data that's available for COVID-19. If anyone has been on the Pickens County COVID-19 website in the last couple of months, we have very much simplified it to try to take some of that analysis out to look at those trends. So just want to highlight that that will eventually be going by the wayside. We are removing that COVID-19 recovery and response webpage and are instead building new information and the most up-to-date information onto the Public Health Civics Plus website. But that will be a gradual transition. It's going to be around for a minute. So don't want to kind of set off too many alarm bells, but really do want to try to encourage, if anyone's interested in checking on this data real time, that these are going to be the 3 best up-to-date, most specific data that's going to be available for COVID-19. So that was it.
Thank you, Carly.
Yeah.
Question from Dr. Levin.
Oh, I just wanted to add, just a report from what we're seeing at the hospital. So there were 2 inpatients a couple weeks ago, which actually for us is significant. There hadn't been any for months. The healthcare workers, the numbers are consistently up over the past few weeks of healthcare workers with COVID. I think it was 3 to 6, which is significantly higher than 1 to 2 out. And then the hospital reverted back to mandatory mask wearing with patient facing care. So we had a few months of not having to wear masks, and we're definitely back to and being enforced that you have to wear a mask if you're in front of a patient. It's there, it's definitely has surged back. I mean, just the way we're looking at things in the ER and why has COVID surged and flu hasn't, right? Is it maybe these new variants? But it's just interesting, and I think everything that Carly said in terms of transmission in the summer, we know that wintertime transmission is higher, but we're seeing this now. So is it just a new variant that's kind of taking course and spreading the course? But it's definitely there. So it's interesting.
So the public will see that Aspen Valley Hospital has a mask protocol now, masking for
For patient facing care, yes. Yes, and that is being enforced. And that happened, I think, a couple weeks ago.
Liz?
Yeah, Carly, do you know if CHS are the COVID vaccines available in the VFC or the 317 program for the uninsured?
Yes, so this is going to get messy. We have little snippets of information here and there. So I don't want to say that this is permanent for the foreseeable future. I think that the state was really trying to be proactive in communicating out how the vaccines will get distributed. So for our understanding currently, the vaccines are going to be available for through Vaccine for Kids as well as at Medicare and Medicaid rates. However, the big question, especially for our community, is what is that going to look like for insured individuals? And one of the headaches, and I think, Liz, I'm sure you know better than most, or you probably know more than I do at this rate, but is that the state is and the CDC is functionally saying that now that the federal government is no longer purchasing the vaccines, that providers are going to be asked to purchase these ahead of time, as any normal vaccine would, and that the provider will be kind of responsible for fronting not only the cost, but then potentially eating the cost if those vaccines don't get administered or paid for. So we have sort of these systems in place to provide vaccines for certain subsects of our population, but not for all of them. And the question remains, what is the cost of the vaccine going to be? And what is insurance going to cover? And it's hard to ask CHS in particular, especially CHS, who wants to provide the vaccines, who wants to do it. If, as Kurt was mentioning, there is this minimum order. Prior years, it's been 1,000. CHS is likely not going to be the provider who's going to order 1,000 vaccines and be able to eat that cost if they don't get administered.
Thank you.
There's more unknowns than knowns right now. So I don't want to like paint this very bleak picture. It's just going to take some more information and some settling at the federal level, and then that trickle down to us before we can say definitively how that's going to happen.
Thank you for that, Carly. That was a data-rich presentation. Wow. I'm reminded of a comment made by Elizabeth Colbert, a reporter for the New Yorker who writes books on climate change and articles on climate change. And she quoted somebody saying, yes, I'm pessimistic, but that's no reason to be gloomy. And after we hear from, the incidents of climate change, perhaps driving disease transmission, and, all the other things that are happening, that's my quote for the day. I'm sorry.
I was thinking the same thing. I was like, it's gonna be nice leaving this meeting. Don't breathe the air. Don't drink the water.
Welcome to the coolest summer of the rest of your life. Historically, this isn't really completely new. Aspen had a historical water problem back in the day with the water system here back in the 40s and the 50s. And the famous quip, it was a case study, I think, for, I don't know, one of the national institutes that, we really had a problem with our water system. And the quip from Freddie Fisher, who was a local pundit and jazz musician, was that, don't drink the water, it might be your own.
Giardia.
Was it Giardia? Okay.
And one of the sewer pipes was going next to a water pipe where there was what do you call the Bernoulli effect or something where the water pipe was pulling in some of the sewage because it was a couple inches away.
Yep, that's why we have
You turned out fine.
Jim Marcolinus used to.
It's 3:22, round robin. We've got 3 minutes to round robin. I need to get out of here to 2 more meetings, which are down Valley. So if anybody has anything they want to share, I'm gonna cut them very short. Linda.
Alpha-gal
That's the second one.
syndrome, tick-borne, allergy to meat and milk. And and it's widening because of our climate change. The increase in heat and the distribution of the ticks is coming west. And so it's good to know.
Thanks for Lone Star tick.
Don't go outside. Don't go outside.
Double wrap.
But maybe you know more. Can you know more about that? Alpha-gal?
I haven't seen it.
So the Lone Star tick that spreads that disease, and it's it actually creates a sensitivity to creating a meat allergy. I think at this point, in Colorado, we haven't found the Lone Star tick. And I don't believe, at least here, we expect to, because the drought conditions will make our climate drier. It's like the tick that's responsible for Lyme disease. We're not anticipating that to be an issue here because it needs a very wet piece. I need to double check on that, but we came across the Lone Star tick and we're doing a presentation. It's very interesting.
So between meat allergies and not eating fish, we're gonna have a lot of vegetarian. Good news.
As long as the soil doesn't have PFAS in it.
I will say also the state's collecting ticks if anyone finds any. So if you find a Lone Star tick, you can submit it to the state for sequencing. So
Ticks will be the only climate refugees who aren't coming to college. Although I have another one, Tori.
Well, this is maybe not appropriate for this group setting, but I just wanted to compliment Pickens County on and environmental health in Pickens County for the compost and waste ads that you guys have been doing. You've been doing it for years, but once again, like last week, I saw a new one that caught my attention again. I wanted to say congratulations, but I also want to say that the city of Aspen is embarking on a compost program in our downtown, and I hope that the county and the city are working together as much as we can on this environmental issue.
That's great, and yeah, our compliments to the city for going big on that. That's something we're looking forward to. And the other news, if I can share from the landfill, regarding our solid waste diversion program, which in the first 6 months has diverted.
This has to be good news.
Good news is we've diverted 32 tons of waste that would have ended up in the landfill has now been repurposed through our solid diversion program, whether it's furniture or, you know, components that have a more use. So we're making progress out there. So that's the good news. We could end on that.
Send us an email.
Oh, and I can share, finally, I was in a call on greenhouse gas emissions with the Keystone Center yesterday, and it involved public officials from around the state. And the one thing that I shared, we were talking about sustainability in buildings and you know, how do we become more sustainable in everything we do? So we're not producing so much waste. And I was reminded, because we had a memorial party for celebration for Hattie Billings, who was a longtime local who passed away. But she and her ex-husband Dean had built probably the only sustainable building in Aspen, which was a rammed earth building made out of soil collected locally and built into might have been 2-story, maybe 3. A building over on Ute Avenue, which has been replaced since the last 20 years. But I was thinking that was probably the first modern sustainable building in our community. And if we could just get back to thinking about trying to be sustainable, so the waste stream doesn't have to be so eccentric. We don't have to import stone from China to build our houses. So anyway, I don't know where that came from. Other than that, we're trying to reduce and limit and be more sensible about how we do things. So there's room for improvement on all fronts. Do I need a motion? I need a motion.
Motion to adjourn?
That's what I needed.
Second.
I'm a second. All in favor?
Aye.
Thank you all. We are
Thank
done.
you.
We're out.
Still early, Greg. Good
I
job.
did get up 3 minutes early. That's one, 3 hour